Neck liposuction. How is it done? Who is it good for? And what sort of results can you expect? Neck liposuction is a popular procedure for good reason, because it can be done in the office under local anesthetic, meaning just numbing the skin under the jawbone, and through a tiny puncture incision right under the chin get access to the pinchable fatty tissue. So if you were to take your thumb and finger and pinch the skin, what you're basically pinching is two layers of skin with the subcutaneous or under the skin fat sandwiched in between, and it's that fat layer that neck liposuction addresses. Now, there are pros and cons to doing neck liposuction. The pros being that it's easy in-office procedure with really minimal downtime and total comfort, very straightforward procedure to do. But the downsides are the fact that the pinchable fatty tissue under the skin usually isn't the problem for patients who don't like the fullness of their under jawbone neck area. Oftentimes the fullness that one might see in photographs or in the mirror of the neck comes from the deeper structures. That's not the pinchable fat here. What I mean by deeper structures is a collection of tissues, from muscle to deeper fat pockets that liposuction can't get access to glands, saliva glands right here on the sides. If you feel under your jawbone with your thumb and your finger, you'll feel these two little robin's egg shaped tissue structures that are the saliva glands. Oftentimes those are the structures that create fullness in the neck, particularly for patients who are very slim and they don't have a lot of excess fat under the skin. So liposuction should be done for patients in a very judicious fashion, meaning that just for the right people who have a lot of pinchable fat. If you're able to pinch more than half an inch, then perhaps you'll get an improvement to the appearance of the neck. But if you're feeling your glands that are heavy and that are drooping downwards, then oftentimes neck liposuction is not going to work well, and we need to consider other techniques, specifically deep neck sculpting, which is the procedure that I often do very frequently to reduce the fullness of the glands and sculpt the deeper structures to really get a beautiful neckline and jawline. So in consultation, we'll talk about what sort of anatomy makeup you have uniquely and what procedures would be appropriate to treat your neck to get a nice clean neckline and jawline. And I'm always aiming for the 100% correction so that patients can be very happy with the results. And so we have to be careful about using neck liposuction for the appropriate reasons.